We are united in diversity. We are very heterogeneous in our opinion.
If we do not renew our partnerships with the rest of the world, Europe will not be relevant.
We can make it if we are together as Europeans.
Do you genuinely believe that countries will manage to reach these very ambitious targets?
Good morning, everyone. I'm Claudia Chiappa. I'm a health reporter at Politico, and you're watching Politico Live, a live extension of our nonpartisan journalism. Today's discussion is on the Critical Medicines Act, a highly anticipated piece of legislation that is set to be unveiled by the European Commission in early March. At its core, the Act is the Commission's attempt to prevent drug shortages across the bloc, aiming to strengthen Europe's supply chains, reduce our overdependence on third countries for essential medicines. The Critical Medicines Alliance, comprised of civil societies, industry, and EU countries over the past year, has drawn up recommendations that will help shape this act, recommendations that we wrote about in Politico a couple of weeks ago. Today, we're taking that conversation further and we'll debate what tools are needed to fix Europe's medicine shortages, how the Act will balance regulation and competitiveness, and other hotly debated topics like solidarity and stockpiling mechanisms. We have an expert panel coming up, but before we dive in, a few housekeeping points. A big thank you for Teva for making today's event possible, and a warm thank you to you, all of you that are tuning in online. At Politico, we like to make these discussions as engaging and interactive as possible, so engage with us by tweeting at @LivePolitico and send us your questions via Slido using #EUCriticalHealth. We'll save a few minutes at the end of the panel for your questions, and we'll give priority to questions with a name and organization. You can already, in the meantime, answer the following poll. What is the biggest threat to secure Europe's critical medicine supply today? Presented by Teva. We'll look at the results of the poll at the end of our panel. Before we kick things off, we'll hear from Mikkel Nitka, Senior Vice President of Generics, Head Europe and OTC Global Head at Teva.
Good morning, ladies and gentlemen. I hope the day started well for you and you can feel some first breath of spring today. But we'll discuss very serious issue. So we'll discuss the sustainability of the European healthcare system and very important element, which is the access to critical medicines. To open the discussion, I would like to share with you the results of Teva generic health check analysis and share some numbers, and to share with you the critical numbers which are absolutely like the red flag for us. So first one is, if you look at the access to medicines, you need to look, how many suppliers you have on the market. So today, 46% of generics from the list of the critical medicines have only one supplier. So almost half of the medicines, they are supplied by one company. So this is really big risk. Can you imagine what will happen if this supplier will disappear from the market? If you go a little bit more deeper and look at the medicines which are supplied by the majority of supplier, which means the one which owns more than 50% of the market share, then the number is going to 83%. So 83% of medicines are supplied by majority supplier. This is again the second risk. So then you ask the questions, okay, there are the average numbers. Yeah? So 46% is the average number, 86% is the average number. So you need to consider how is it in the key therapeutic areas, the most important therapeutics areas for the public healthcare. So the number is growing to 86% in cardiovascular, in cardiology, to 84% in oncology, 81% in mental health, and 75% in antibiotics. This is the numbers which are really impressive, and we have to remind that the risk is there. Why is it like this? So there are many reasons for this, but the main is that we don't have the mechanism. So we have the absence of price flexibility combined with increasing regulatory and environmental requirements. So nowadays, there are more and more obligations in the pharma industry, like the wastewater directive, which are bringing more and more obligations. So this is influencing the way how the companies operate, and this is also impacting the way how the market looks like. So we see more and more consolidation, and this consolidation is impacting the access to medicines because we have less and less suppliers. So if you look at the number of products which disappear from the markets, then it's the average of the critical medicines is declining faster than the overall medicines we have in Europe. And also on the top of this, just to understand the pressure, so the customer prices raised by 30% during the last 10 years, while the medicines prices fallen by 8%, generic prescription medicines fallen by 8%. So what we can do and why the Critical Medicines Act is so important, because we hope that this Medical Act will restore the balance. So there are a few mechanisms we can discuss, and I hope the discussion today will focus on this. The first is about aligning environmental, health, and industrial policies. So to put some more flexibility in terms of pricing. Another one is the solidity mechanism. So we are looking for mechanisms which will allow us to move the goods between the countries. So in some cases, we see, that countries are pushing for the stockpiling, so increasing the stockpiling. But then in other ones, we don't have the stock at all. So the technical parties, the very much practical parties, to ensure that we can move the goods between the countries and ensure that we have the equal access to medicines. This is absolutely crucial for the next years and for the healthcare system in Europe and for the access to critical medicines. So we hope that the Critical Medicines Act will restore the balance and that the discussion today will bring us some tangible outputs, because now is the call for action. So we are already late. If you look at the situation today and the numbers I mentioned before, 46% of generics with only one supplier and 83% of generics from the critical list with supplier with majority market share, that is really the red flag for us. We have to act now. So with this, I wish you the very good discussion. Thank you very much for your attendance. And I hope that today you will find the right solutions, the right measures to ensure the access to medicines. Thank you very much.
Thank you so much, Michal, for this introduction, also helping us understand why, this act is so important. I will now move on to introducing our set of fantastic speakers. We have Jakub Dvoracek from the Deputy Minister from the Czech Republic's Ministry of Health with us today. We have Daria Kurus-Poje, Vice President of the European Association of Hospital Pharmacists, who can also share the experience of hospital pharmacists on the ground and what they're seeing. We have Thomas Steffen, State Secretary of the German Federal Ministry of Health. And then we have Adrian van den Hoven, Director General of Medicines for Europe. So thank you all for being here. One quick thing for full transparency, we worked hard to get the Commission and DG Sante on the panel with us today, since they are drafting the act. But despite our attempts, they told us that they were too busy, understandable, but just for transparency and why they're not here today. We have a lot to dive into, so thank you all for joining us and for being here. Also a reminder to our speakers that we do want this conversation to be very interactive, so if I do direct a question to someone, but someone wants to jump in, feel free to comment, respond to anything that's said by also other speakers. So great. I want to dive right in and start with a question to all the panelists, maybe starting from Adrian. We have this act that we've been waiting for a while. The Commissioner Varhelyi set a deadline for 100 days. It's coming very soon. What can we expect from it, and what are some of the things that should be priorities in this act?
Hi, thanks a lot for that question. Of course, I'm not drafting the act, but along with Jakub and others, I'm a member of the Critical Medicines Alliance, which is somehow giving advice or recommendations there. So I think there are three things that really flow from the data that was presented by Teva. So, I mean, it's very obvious if 80% of the critical medicines are supplied mainly by one company, that we have an extremely consolidated production for these critical medicines. And so there needs to be an attempt to diversify the supplies. So I think the first aspect is we need to incentivize investment into production, into more resilient and diversified production, which means also investment into Europe. And the main thing here is to fund this. So I think most of the funding will come from the private sector, from my members or API producers who may not be my members. And there we need some support either through tax incentives or through EU funds or something along those lines. Second thing is, beyond investment, we need to reform somehow the generic markets to stimulate more suppliers. If we're dependent on one supplier for the ultra critical medicines on the critical medicines list, and probably this is a bigger problem in the whole generic sector, that exposes us to consolidation risks. So there are ways to do this with procurement reforms, also pricing reforms, which is a bit more complicated because it's different member state by member state, but this is definitely possible. And the last one is this solidarity element. I think there are two aspects there. One is there has to be a balance between national stockpiling initiatives and EU solidarity. And also there needs to be more flexibility for manufacturers to move products around. Right now, it's extremely difficult if you have, say, French products or Czech products or German products to move them from one country to the other, either because of language issues or because of regulatory issues. And that should be made more flexible, mainly to deal with shortages, of course.
Thank you, Adrian. A lot of aspects, and yeah, we'll definitely get into more later. Thomas, I want to turn to you with the same question from Germany's perspective. What are some of the things that you would like to see in the Act that you think that are key elements that should be in it to help with shortages?
Yeah, many thanks for today's invitation, and I'm more than happy to contribute to this very important discussion. And as others said, we urgently need the Critical Medicines Act. And let me stress, not because we want to lead a theoretical discussion about supply chains, but we are all, in my view, united in working for the health of around 450 million people in the European Union. So we want to save lives, and that is our job, and that is why we need that Critical Medicine Act, and we need it in the right way, that it will work in practice in future times. And to be honest, we had been relying on global and international cooperation when it comes to the production of ingredients, of medicines. We have a high dependence on China and others. And that had been working for a while. But now, as we all know, we are living in significantly changed circumstances. We live in a new geopolitical landscape, unfortunately. And that is why exactly we have to strengthen Europe, and we have to strengthen European production. And this is what the Critical Medicines Act is all about. And in my view, we need a couple of measures or multiple actions in the Critical Medicines Act to be implemented than at short notice. Let's, for example, take public procurement. In my view, we should better reward a production within the European Union than it was possible in the past. That is why we need an amendment to the public procurement rules of the European Union. Second, as Arjan also mentioned a couple of minutes ago, we need some financial incentives. And this is always linked with the question of state aid law of the European Union. And I'm not advocating a race to higher state aid in several member states of the European Union. But what I'm advocating for is that if needed, and as a matching aid, for example, with regard to the United States, we should be able to also subsidize special cases where we want to keep the industry within the European Union and not to lose the production to other regions of the world. And of course, the point of stockpiling is also a very important one. I can well imagine that in future times we might have a higher degree of harmonization of national stockpiling strategies, and I'm very interested to see what the recommendation of the Critical Medicines Alliance will be, then to be discussed further also on a political level. And of course, it goes without saying, that was just mentioned, and I also mentioned it several times, that in the past we had been relying on our international partners. This might not work in future times, but maybe we need new partners and new friends in the world. And we just heard Commissioner Vestager saying that we need partnerships in the world when it comes to the production of medicines and ingredients. It's not always about China. There are Asian countries, African countries being interested to become a good partner of the European Union. And that is why, in my view, we should also negotiate, let's say, compacts with third countries about the production of medicines in future times, in the sense how we can better diversify the future supply chains and how we can, let's say, not put all eggs in one basket, and that would also strengthen the European Union. Thank you.
Great, thank you for the points. Also for bringing up the geopolitical element. Obviously, shortages are often exacerbated by what's going on in the world. We've seen it with COVID, we see it with the ongoing war. So always good to keep that it's a very strong influencing point. Jakub, we'll turn to you real quick for this too. Obviously, you're also very involved in the alliance. So can you tell us, what are a lot has already been said, but what are some of the things that from this act you think are non-negotiable things that you would love to see that would really make a difference?
Thank you, and thank you for inviting me. It's always a pleasure, to have a discussion on the political level. And one added value which also comes, from your interviews and discussions. You are inviting the number variety of stakeholders. That's what I believe is unique on the Critical Medicine Alliance. We don't have, this experience, from healthcare for years. So I believe, this really, brings a good perspective on what we need, in the area of critical pharmaceutical. Before I will come to let's say the what we try to cover, it's also good to mention it that the last 3 years the interruption of supplies and unavailability becomes highly political issue in all European countries. So I believe we will move quite quickly in the coming months to get the final material as soon as possible on the member state level, but also on the European Parliament level. And just to edit, what was mentioned by Adrian and Thomas, we have two materials now, or we will have the Critical Medicine Act and Pharmaceutical Package. And we have to be clear what should come to package, what should come to Critical Medicine Act, regulatory issues probably to the pharmaceutical package, incentives, procurement, all the other areas to the Critical Medicine Act. And what was also mentioned, and I would like to highlight it, is the focus, on the whole life cycle. So investment, but at the end, procurement plus reimbursement. And we have to also acknowledge that number of those all generics molecules are in the area of primary care, So in a number of member states, we do not procure those kind of pharmaceuticals. It's just the setup of price and reimbursement. So we have to work, on those two areas, reimbursement and the pricing and the procurement criteria. And all that together could finally bring us to much safer state than we are now.
Thank you, Jakub. Also good point, on looking at the entirety of the supply chain, not just looking at the manufacturer, but also the later stages. Daria, to you, I would love to hear from you. Obviously, same thing, like what would you like to see in the act, but also bringing in the perspective of hospital pharmacists, what you're actually seeing on the ground, what are the current state of shortages and how it's affecting pharmacists.
Thank you very much, Politico. Thank you, Claudia, for inviting European Association of Hospital Pharmacists. It's always a pleasure to be among such very much appreciated stakeholders and to bring this important topic at the table. And now it became a political issue. The shortages, as we, as a frontline healthcare providers in hospitals, with dealing with medicines and medical devices as well. We started to compile a study on shortages from 2013. So seeing the Critical Medicines Alliance and after that Critical Medicines Act coming into real life, it's really, really good to have this, dream come true, that something is really acting in real life from the political and from national European level to come all together. And I agree with all that Mikael, Adrian, Thomas and Jakub said. I would just like to not to reiterate what all they have said. I would just like to say that we really need tangible results in addressing these shortages, not just talking about it, but not just on the critical medicines, but all the medicines. For instance, that hospital pharmacists can dedicate their time not only on trying to find alternative for or generic substitution for medicine shortages, as Mikael, Nitka and Adrian already said, that 46 of critical generic products have only one supplier, while 83 of critical generics in the critical lists have one supplier. For instance, I can say from the experience we have or tender, one winner takes it all. We have generic antibiotic, amoxicillin, clavulanic acid. And when this tender ended, we didn't have any amoxicillin, clavulanic acid in our state. For instance, I come from Croatia, and therefore we had to switch to another. And as we did not have the exact alternative, we switched to cefuroxime, which is not a good alternative. So the patients were endangered and they were not treated with the best therapy possible. Then we have the more recent example of disruption of drug market supply due to shortages in saline solution in the other parts of the world, because saline solution is really important for maintenance and replacement fluid therapy in adults and children. And it's one of the key medicines in the hospitals because we receive really suffering patients. For instance, we also, as you also know, that community pharmacists are also experiencing shortages, but we are mostly experiencing IV solution, intravenous solutions that community pharmacists are not dealing with. So we have to act quickly. We have to act now, because if we do not find alternative solution in an hour or two, patients could die. So I'm really looking forward to these efforts that are doing on the European level that are I believe will solve some of these issues that are we dealing now on everyday basis. Thank you.
Thank you, Daria, for bringing in also this sense of urgency and the real life impact that this has on patients everywhere in Europe. So I want to now start going through some of the mechanisms or the suggestions that were mentioned, that we talked about, that could help with diversifying supply chain, strengthening it. Starting from state aid, and maybe I'll go to Thomas because you mentioned this too. One of the draft of the Alliance recommendations that we saw included changing state aid rules to allow for countries to better fund manufacturers in Europe. I wanted to ask you, what are your thoughts on this, and if there's anything else when it comes to state aid rules that you think could be changed to help incentivizing manufacturers in Europe?
Thank you. I think when it comes to state aid, there are three things that matter. First, I just mentioned we should not advocate for a race to subsidize each and everything, because for many, many good reasons, we have quite strict state aid rules within the European Union, and we benefited from that over the past decades. What I'm saying is that we need rules that allow us in specific cases to give financial incentives to an industry that we urgently need with its production within the European Union, and not to lose the production to other regions in the world. That means on a case-by-case basis, we should look at those issues, and then we should decide, of course, together in close cooperation with the European Commission, and DG Competition is doing a great job, what we can do financially. This is the first point. The second point is that, of course, when it comes to the timing, we need a, let's say, decision by DG Competition in a way that the industry can live with that, and that we can give predictability to the industry and to the investment by private investors to invest in the European Union. And you might know that there had been cases like the penicillin case in Kundl in Austria that has taken 3 years of a decision. And in my view, I think 3 years, this is too long for an investor to wait for. That means, in my view, we should look at how we can, together with the Commission, a little bit accelerate the decision making to give that kind of predictability to the industry. And the third point, in my view, is about the substance of the state aid. We should then see what the Commission is willing to do, whether we can strengthen a kind of matching aid, which always implies that we look at a scenario in a third country and what a third country would do and could offer to the industry, and then compare it with our own possibilities within the European Union, or whether there are other approaches like a general interest of the European Union to keep an industry within its borders. There might be different approaches to the substance of a state aid decision, and we are very willing to discuss that further. The important point is that we get, let's say, some kind of good approach in the Critical Medicines Act, that we are willing to work on state aid in a kind of dynamic process and not in a kind of static status. The current status is working, but not working in the maybe changed geopolitical environments that we are now living in. Thank you.
Mm-hmm. Thank you. I wanted to bring in Adrian real quick on state aid. But is there any concern that state aid usually goes more towards innovative products? Like, is there anything that could be done in the act that could help public funding also go towards generics, the generics sector? Oh, I don't think we can hear you, Adrian. I'm sorry.
Sorry, as Thomas was pointing out just now, the Kundl decision, which took about 3 years, was delayed, I think, largely because of this issue that you're referring to now. So basically, I think there are two main problems with the current state aid rules. One is that innovation refers to first industrial deployment. So this kind of financial support under EU state aid rules could be made, for example, for the deployment of the COVID vaccines, which were a new, basically chemical or biotechnological form. And so therefore you needed new manufacturing techniques to produce them. So EU state aid rules would allow the funding of that kind of, let's say, manufacturing. Most of the time, the innovator industry doesn't need that kind of funding because let's say the the cost of the medicine or the vaccine is going to largely take care of the manufacturing costs. If you have an older molecule like a critical medicine, most of them are quite old, there the European Union will not consider that an innovative manufacturing technology, and therefore it will normally be rejected under state aid. And this is why the Kundl decision was so controversial and why it took so long. So I think for this, for the critical medicines, this needs to be allowed. The second key point is, I think, on regional aid. So European production is actually spread around quite a bit. So of course you have the big countries like Italy and Germany and France with a lot of pharmaceutical production, but you have pharmaceutical production in almost every member state. Of course, in Czech, there's quite a bit of production, but also in Hungary and other East European countries. But even in tiny little countries like Cyprus or Malta, they have production. So one of the things you can use is regional aid, but the regional aid rules are very restrictive if a company that's not an SME, so has more than 250 employees, applies for it. And there are very few pharmaceutical or API manufacturers with fewer than 250 employees just because of the scale of the production. So therefore, they cannot qualify. So I think that's one. And finally, there should probably be a fund, like an EU fund dedicated to supporting manufacturing where it is critical, of course, with specific rules. That fund doesn't really exist today. So I would say those are the three kind of main areas that should be under focus.
Mm-hmm. Thank you. Jakub, yes.
Can I? Okay. I will, if I could react, what Adrian and Thomas highlighted. We have to be selective. That's what I fully agree. On the other hand, I also believe, that it's very difficult to say, what is the critical medicine. We really tried to do quite analytical work also in the Czech Republic to ensure that our own list of the critical medicine is, let's say, done based on the local needs. And when you start to do such a thing, you will find it out. It's not just about the essential antibiotics or antibiotics, but you finish with very basic medicines, and your list becomes quite extensive through the time. So what we will probably need is, let's say, focus on the groups, probably based on the ATC groups. We will have to have also a quite good European coordination, that we will not, let's say, support the same projects in the different countries to ensure, that there is some kind of coordination. And we will also have to focus not just on the producers of final medicines, but also on the producers of API. And with the API, it will be quite complex to really have it a fast process because of environmental standards in Europe. But we will have to find a way, because it's mainly it's really a lot about the API and about the production of those ingredients. So there is a lot of work, which we will have to still probably do it after we will see the first draft of Critical Medicine Act. But I think what Critical Medicine Alliance brought is the overview of what we need to cover in the Critical Medicine Act. So we will not miss the key parts of support which is necessary for the generic industry. And as Adrian said, the generic industry is each and every European country, big or small. But we have quite a legacy of the production. So it will be a pity if we will lose it in a current situation. And one last thing, if you see what kind of support we're providing to innovative industry, it's a very general support. We just say, okay, you will get extra protection for extra time. So we are creating the artificial environment where we support the innovation in Europe and innovative pharmaceutical industry. So we will probably not be able to do it the same for the generic industry, but we will have to try to find a way, how to generally support this industry in Europe.
Thank you, Jakub. I actually oh yes, Daria, is there anything you want to add on state aid or?
Yes, you also, you cannot avoid, unfortunately, shortages, but when you have everything system in place, and if the situation was ideal, you will still experience shortages. And you also have to have in mind that possibility of hospital pharmacies of compounding of licensed medicines in shortages as the last resort as well. This is also one of the possibility of solution. For instance, as there was the shortage again for antibiotic amoxicillin, clavulanic acid on European level, and we compounded this kind of antibiotic for pediatric patients, as these really saved lives, as well as radiopharmaceutical for cancer treatments and diagnostics, as there are isotopes that have to be ready to use and compounded in hospital under hospital exemption, which save lives. And in case of shortages, this means patients' deaths if you do not have ready to use radiopharmaceutical, as you're waiting for other options which are not good. Also, as you already mentioned, health policy should invest into improvements of demand tracking, planning, and forecasting infrastructure. They're already doing this, but this needs to be much more done in a more strategical way. And the last but not least, what I would like to point out, the importance of information sharing and collaboration between all of us. That's why, for instance, this kind of series, is really good, that we can share all of our experience and collaborate and come up with a good and quality solution that will fix the problem, and that we can use in our everyday professional lives, not just from a hospital pharmacy point of view, but from the community pharmacy, but from your families, children, and parents as well, and relatives. Thank you.
Thank you. Daria, I actually want to stay with you real quick to follow up on, you mentioned information sharing and also the importance of monitoring the situation. How's it currently, the communication with hospital pharmacists? Do you guys know ahead in advance if there's going to be a shortage? Is there still things that could be improved there?
Unfortunately, the last survey that we did in 2023 that were done among almost 1,500 hospital pharmacy participated in that survey from 36 European countries. 71% of them reported that communications rarely happens with manufacturers. And unfortunately, this is still the case. So we do not find out about the medicines that is in shortage until we order the medicines, and then we do not receive these medicines. So this is unfortunately something that still needs to be done, and EMA is doing a lot of things in that matter. For instance, I have example of good practice in Portugal, where their Infarmed has created a direct communication channel where great majority of national hospital pharmacists insert information quickly of shortages, and then they can automatically check of possible alternatives. So this could be one of the good example of good practices that can be shared to other European countries, as well as improve communications. And I hope that this Critical Medicines Alliance and Critical Medicines Act will also improve communication. It's really, really important, as we really have a lot of pressure coming from patients, especially from the physicians and nurses, as they think that the shortages are happening due to, for instance, we didn't order the medicine, or the hospital pharmacist took the medicine. So the pressure is really high because the operator wants to give the patient the medicine at the time when he said the patient needs it, and he is right. So we would like to avoid that. Thanks.
Okay, thank you. I want to turn a little bit and start to talk about another element of the Act is the focus on international cooperation and solidarity aspect. So the EU has already introduced the European Voluntary Solidarity Measure, but one of the recommendations that we saw from the Alliance was to expand it internationally. I wanted to ask, perhaps Adrian or somebody else wants to chime in on how would this work, and how would country go about being part of this mechanism?
Yeah, so I think the logic in the Critical Medicines Alliance behind this is to see kind of in advance if the EU could find reliable partners in case of a shortage, to where products could be imported, Or on the reverse, if a country, let's say, would have a shortage, some EU supplies could be diverted towards those countries. This already happens to a large degree in the event of a major shortage. So Daria was referring to standard solutions, which are very, very important for hospitals. I mean, what happened in this area is that there was a hurricane in the US that blew out a factory. And a couple of weeks later, there was a massive storm in Valencia, which happened to hit the same kind of factory. So you had, two unexpected weather events, maybe. Certainly no one expected those locations to be hit by a hurricane or this massive storm in the case of Spain. And since then, basically, the industry has been collaborating with the agencies in the US and in Europe to try and manage this kind of situation. So I think that's an example of how this works. So I think it's a good idea. The main thing for the European Union is that, most likely this will be more collaboration with highly regulated countries, like, say, Canada or Switzerland or Australia or the United States. I guess the kind of question mark is around the United States, because right now they're threatening to impose tariffs on pharmaceuticals and active ingredients. We would really advise not to do that, because how are we going to work with the EU institutions to, let's say, cooperate with the US on a shortage that they have, and they have chronic hospital medicine shortages in the US, far worse than what Daria is experiencing, okay, because they have a fundamentally flawed, structurally in need of reform, problematic hospital market in the US. They permanently have injectable shortages, and it's the European industry solving those shortages together with the national agencies of the European Union and the FDA, almost always. Are we going to tax the companies who are solving, helping to solve these shortages, and punish the European agencies that are almost always helpful? So, I think this is really something that needs to be thought through. Medicines are treated very differently in the international context, in the international cooperation context. Germany is the leading country in terms of health cooperation in the world. And, there's a reason for that. It's very important to international relations as well. So I think, this is something that's very important. So globally, I can say we support this idea of a voluntary solidarity mechanism. It should really work and should really be helpful to foreigners, and also ask foreigners to help us. But, there has to be some goodwill here, I think, to make it work.
Mm-hmm. So there is some concern, I assume, with the threat of U.S. tariffs on pharmaceutical medicine, not just on how this would affect solidarity at a global level, but is there any concern also on its effects on supply and pricing of generics?
May I still come back, to the first part of the question which you raised with Adrian, because it was about the solidarity and sharing the pharmaceuticals around the EU member states. And just to use the example which Adrian used, the physiological solutions. It was quite a good example also from perspective of what panic can cause, on the market, because in the reality the supplies to Europe were not really increased significantly, and there were a number of companies, European-based companies, smaller one, who were able to replace this stock. But because of a very let's say panic situation, in hospital pharmacies, they start to collect supplies, and then we had a big problem. So what we definitely need is better sharing of data to really see, what is the consumption, what is the forecast for production, how the supplies will come, and to create a good information network and set up, for hospital pharmacies, but also for the public pharmacies, to ensure them that, for example, situation will not last long. And we also need to get the chance to coordinate in those critical situations, the flow of the supply to hospitals and to pharmacies to ensure that there will be no, let's say, pharmacy doing the overstocking and the others, who will not receive any pharmaceuticals for their patients. So this is something, what we still need to focus. It's the part of the discussion also at the Critical Medicine Alliance. And I believe it should be also the part of discussion on the digitalization of the Europe, full mandatory e-recipe, the e-pill, simplification of the package, so we can really, get the one box, one package for all European patients. And also we have to focus on the pricing to ensure, that if there is a different price in member states, to ensure that we have a mechanisms to quickly increase the price or decrease, and to manage the supply, country by country. So it's just to edit, what Adrian raised, on this topic of sharing and solidarity in data.
Mm-hmm. Hi, yes, Daria.
Sorry, regarding saline solution, unfortunately, it was not panic. Not just my hospital, but the colleagues from other hospitals in Europe also experience shortages of this solution on their everyday basis. But it's a good thing that there was a solidarity and it was solved really quickly, and it's still solving. And we need to have a support for manufacturing processes and investments that support this kind of production of not just the saline solution, but other medicines as well, with green and digital transitions as well, as security of supply, joint procurement from more than one manufacturer. This is also one of the proposed solution. Also to include healthcare professionals, not just hospital pharmacists, community pharmacists, even to include medicines agency, and not from the national levels, but from the European levels, but to include as many as stakeholders as possible, similar to, I really like the Critical Medicines Alliance. It involved almost all the stakeholders from the from the industry to the ones to the hospital pharmacists, which are really struggling with shortages. Sorry for bringing this up again on everyday basis. So,
no, of course.
Can I react on Daria just very briefly? Daria, you mentioned something, what is also very important, and it's the individual, the competency to prepare the individual prepared pharmaceutical products on the level of the pharmacy. We somehow forget in the Europe, that there is a number of things, which could be done practically in each and every pharmacy. We lost partially also the capacity to produce, those essential pharmaceuticals at your level, especially, for example, for children, like different solutions and so on. And also the good example of the physiological solutions. That's also something what in the past we were able to produce, on the big pharmacies, in the hospitals. And somehow we are losing this flexibility to work, with what we have, and somehow, to cooperate and to increase, the small capacities which we could have it on the level of hospitals, on the level of hospital pharmacies.
Yeah, that's why we need a much more flexible, as you already said, mechanisms to help us in these cases, because we cannot produce for all the country, but for the region, it's possible. So I think it's one of the possibility of solutions that that's why I said we have to all come together, and there is the cake, a slice of cake for each one of us, and we can help each other.
Yeah, but I have to intervene on this one a little bit. I don't disagree that we can rely and work with the capabilities of the pharmacists, either in the hospital or in the community setting. In the community setting, it's less and less, right, that you see this now. In the hospitals, there's still capability, but maybe we can restore this capability in the community pharmacies as well. I think there is a role for this. I think one of the difficulties that I see, though, is that when it comes to hospital medicines, for example, the GMP rules are getting stricter and stricter and stricter, with very huge costs. So for the new sterile GMP rules, for example, it's about 6 million, 7 million euros per production site to upgrade to this kind of new rules. Okay, it will not work if we have a different sets of rules between, let's say, compounding and production. I know hospitals are complying with GMP. I know this, but I mean, here we can see, it will not be possible to have alignment there in this particular case with, to say, the new sterile rules. So then how do we balance that as well? So I think this is also something that we need to figure out. We cannot apply stricter and more expensive rules on the manufacturers and then have somehow directly or indirectly a different set of rules. That's the only concern. But otherwise, I agree that we need to use this capacity where we can do it.
Thank you. I'll allow you, if you want to give a quick response, just ask you to keep it tight because we're nearing end, and I do have to also get through the questions from the public. So.
Sorry, I have to respond to Adrian's. Because I agree there are more and more stricter rule, but there is also solution to have like regional hospital that will produce, for instance, saline solution for the whole region. So you invest in the region, you do not invest in each hospital, it will be too expensive. So this has to be done really strategically and on international European level. So we all align with the same standards, so the patients get the best therapy, the same from the EU as an industry and from us as a hospital pharmacist, but it has to be done strategically planned and forecasted infrastructure for this kind of solutions. Thank you.
Thank you. No,
just allow me this last sentence because I'm a little bit worried about the discussion I have to say. At the end of the day, we are talking about European regulation, and this is already highly complex. And in my view, we cannot solve each and every problem by European regulation. We have to concentrate on the big points, and this is exactly what your question was all about. It was all about cooperation between European member states and international cooperation. I agree with everything that was said, and we also have to look at local production. We have to look at the cost side. We have to deregulate some of the issues just mentioned. We have to do that. I'm just wondering whether we can do each and everything at that kind of upcoming European package. I would urge us really to concentrate on the big things, to facilitate, for example, cooperation between European member states when it comes to purchasing alliances, for example, to boost our market power. That is a very important point by the European Commission. And again, I advocate for better international cooperation, including the United States. It might be an important partner and a difficult partner, but we need them in our boat, and we also should discuss some common ground between the European Union and the United States in future times. This is my plea.
Thank you, Thomas. I want to ask one last question from me, just because I do want to get a little bit into stockpiling really quickly, and then hard to do really quickly because I'm sure it can open up another 20-minute conversation. But then we have a good amount of interaction and questions from our public, so we'll get to those. On stockpiling, this is a pretty hotly debated topic. There has been a bit of difference of opinion sometimes between countries on what excessive stockpiling is. The recommendations call for more coordination, basically at the EU level. Jakub, you have been very vocal on this. Can you tell us what are some of the risks of excessive stockpilings in your view, and what do you think the Act could do in helping tackle this issue specifically?
No, I have been vocal, and then I get the task. So I get this privilege to support the group, which works on the Critical Medicine Alliance to prepare all those recommendations. And I believe we come to a very comprehensive document covering the forecasting, analytical work, proportionality of the stock on the member state level, also the prevention of the waste. And we also work, on the data transparency and sharing the data between the member states on the EU level to ensure, that we are aware what is already stocked, on other member state level, and also, the evaluation of what we are stocking country by country. So I believe, there are a very good list of recommendations which could be used as a base. And we also get quite a good feedback, not just, from the industry, the wholesalers, but also from the member states. So this, I believe, will be partially implemented in the Critical Medicine Act and partially in the pharmaceutical package, because it's really influencing the regulatory part of pharmaceutical package.
Thank you. And Thomas, maybe I would ask you for your input on this, since obviously Germany has its own stockpiling measures, and it has also received some criticism on it. How do you see, these potential suggestions into the act play? Is this something Germany would consider adapting some of its measure depending on what's in the actual act at the end?
My understanding is that each and every member state of the European Union has its own kind of stockpiling strategy in place. And let's not mix stockpiling strategies on a national basis with what could maybe be done on a European basis as kind of future stockpiling in crisis situations. I guess we need the stockpiling strategies on the national level, and we have that in place. And in my view, we did some good kind of best practice exercise to see who is doing what on a national basis. And there is a variety of measures in place. And indeed, as you indicated, some member states, including Germany, we got some criticism on our own measures. In my view, this is a starting point for future improvement, in the sense that we should look at the measures again. We should do the kind of benchmarking that is necessary. The Critical Medicines Alliance and Jakob himself, they are doing a great job working on the recommendations, and then we jump into a more political discussion to see how we can, let's say, in future times better harmonize the strategies. That is what we should discuss further. Of course, it's highly political, because politicians are always accountable to their national voters, and each and everybody is very interested to be on the safe side when it comes to its own strategies. But of course, there's a huge and an important European element to that, and this is the principle of solidarity. And that is why we are willing to look at the recommendations. And you might know we will have a new government in Germany, hopefully coming into office soon. And on that basis, more than willing to continue with that good and fruitful European dialogue to see how we can bring the things together.
Thank you so much. Unless anyone else wants to add anything else on stockpiling that I haven't asked, I'll turn to...
Maybe I just quickly say something. I think along the lines of what was said by Jakob and Thomas, I think if there would be an approach of solidarity for stockpiling, it would be, I believe, along certain lines, which would be there should be a defined list of what needs to be stockpiled based on public health needs. It should be a proportionate duration as well, because stockpiling could lead to a false sense of security. And the third one, and this is the solidarity element, is that patients should always come first. I'm quoting Jakob here from another conference, that it would mean that if there would be a stockpile in the Czech Republic and there would be a shortage in Germany, that stocks would move that way, or vice versa, for the patient, regardless of their nationality, because we're all Europeans in the end. I think something along those lines would go a long way towards achieving a success here.
And I agree to add one point, and I know this point is also very important to Jakob and to others, is that I guess we all share the feeling there is no real internal market for medicines yet. And this is again linked with what Jakob mentioned earlier, the simplifications. And if you buy an IKEA product, of course, you get all the various languages as information for the customer. And I guess we exactly would need that, an electronic patient information, to really facilitate cross-border medicines in the European Union.
Great. Thank you so much, all. I'll jump in a couple of very quick questions. If you can answer really quickly, that'd be great. So one is a somebody wants to know what's what role the Critical Medicines Alliance will play in the future. So after the act is out, if anybody can answer that.
I think I or Adrian can do it, but it's difficult to say. It's depend on the HERA, on the DG HERA, and on the Commission. How they will use the tool they created. But I believe it makes sense, and it will be waste. If we will not keep this tool after the Critical Medicine Act will come out. So I would really plead to continue with this work.
Yeah, I would agree with that. I think, as Thomas was saying, in the end, the Critical Medicines Act will be something strategic, looking at big picture reform of, let's say, how we do things in Europe for critical medicines. And obviously, there will be an implementation side of this that will be very, very complex. And so there needs to be, a way to work together in a cooperative way, as has been going on so far in the Critical Medicines Alliance, to figure out. So, for example, if we're looking at reforming procurement, there's a difference between how they do procurement in Czech Republic and how they do procurement in Germany, if only because, for instance, in Germany, almost 100% of generic medicines are procured. In Czech Republic, around 30% of medicines are procured. So that's a big difference, right? So you need to, figure these things out as you go forward, and the dialogue can assist that.
Thank you.
Just to maybe add to that, my impression is that many European processes are threefold. The first one is announcement, the second one is legislation, and the third one, in my view, sometimes is the most important one, it's implementation. And without implementation, it's void. We have nothing. And of course, there are many good reasons, and Jakob indeed is doing a great job, that maybe we should have Jakob as our master of implementation, where he can continue as the Critical Medicines Alliance to watch and to monitor what member states are doing on the implementation side. Just as an idea, Jakob, and maybe we should discuss that further bilaterally.
Some suggestions for the Commission if anyone is watching. I'll throw in one more, even though we are a bit over time, so hopefully that's okay. It was the one that was the most voted question. I think we partly already answered this, so if you want to add anything on how will the Act address dependence on API production in China and India specifically. I do think we touched on this already, but if anybody wants to add.
I can add something here. I think we still have a relatively strong API sector in Europe. And so therefore, working with the API sector to stimulate investment with some state support, I think most of it will still come from the private investors, but with some support for these environmental and digitalization aspects, technological aspects, I think would go a long way. We've also noticed so we've done some internal statistics, and where we are using European API because some of our members are vertically integrated. It also stimulates the upstream investment into Europe, so into the critical materials, et cetera, that is used in the API. So I think there could, API should be a central part of the Act, and we can build. Europe still supplies around 30% of the API. So, if we expand that, it can work. Maybe for a couple of very kind of national security critical antibiotics, we might want to look at something more in depth there, but maybe that's more for an offline discussion.
Okay, great, thank you. Anybody wants any last words? Otherwise, I think we are at time. We were at time. So that's all the time we have today. Thank you so much. I think it's been a great discussion, really engaging, really interactive, and I think we can we learned a little more about what we can expect, or we should expect from the Act. So thank you so much. I want to thank you all panelists for the discussion again. And we know hopefully a bit more about what to watch for in the Critical Medicines Act to fix Europe's shortages. So we'll take a quick look at the results of the poll that we set at the beginning. Okay, I can't see very well. But okay, that's the results there. Looks like I can't read that far. Okay. Yeah, the race to the bottom pricing policies was the most voted out of the threats to secure Europe's critical medicine supply. Okay, so thank you also for the audience for tuning in, for all of your questions. For Teva, thank you to Teva, for our partner, for making the event possible. We love to hear your feedback, so feel free to email us and the events team at Politico. And finally, you can check out our Politico Live website for the latest events lineup and see what's coming up in the future. So thanks again all for tuning in.
We are united in diversity. We are very heterogeneous in our opinion.
If we do not renew our partnerships with the rest of the world, Europe will not be relevant.
We can make it if we are together as Europeans.
And looking ahead to what is next.
Do you genuinely believe that countries will manage to reach these very ambitious targets?